Thank you for joining us today. My name is Vivian Garcia, and I am the Senior Marketing Manager for Product at Springer Publishing. Today, we are presenting practical tips for new NPs transitioning into practice with confidence. I'd like to introduce our esteemed authors. First, we have Dr. Julie Ossege, who is an accomplished academic and healthcare professional specializing in nursing education and practice. She currently serves as an associate professor at the University of Kentucky's College of Nursing, where she has been a faculty member since 2015. Dr. Julianne Ewen has over 40 years of clinical practice and over 15 years of academic experience and is currently faculty with University of Kentucky DNP program. Most recently, her practice has been with CHI, St. Joseph Medical Group, as an FNP and advanced practice provider, APP leader. So before we begin, a quick reminder. This webinar is being recorded and will be available on demand at www.springerpub.com/videos in about 5 to 7 days post the event. If you have any questions, please type them either into the Q&A box or the Zoom or the chat function, which many of you have used, saying where you're from. So thank you for that. And if you forget to ask a question, there will be a brief survey sent at the end of the webinar, and you can include your question there. So let's get started, and I'll turn the presentation over to Drs. Ossege and Ewen now. Thank you, Drs. Ossege and Ewen.
Thank you, Vivian. So we wanted to happy Nurse Practitioner Week to everybody. All right, so let's, so you're right where you need to be. That's exactly who we wanted to talk to today. So I'm Julie Ossege. We're thrilled that you're here today. We're thrilled to be here today. And as I said, happy Nurse Practitioner Week. Today, we're going to talk about transitioning to practice. And we're going to offer some specific advice. Dr. Ewen and I have been teaching this material for many years and have seen firsthand the frustration and confusion that accompanies this process, which I guess many of you are experiencing as we speak. We've heard it from students. We've heard it from professional NP circles. And actually, this project in the book grew out of a discussion at a national nursing conference where people were talking. There was an open mic and it came to this topic of NP graduates really struggling with the transition from school to getting a first job. So there's a lot of steps involved. We know it's confusing, and we're going to try to work through some of those today. Our goal is to share practical, experience-based advice that's drawn from the book and also from what we've seen in practice. And the goal is also then to make the transition smoother, more successful, and to help you feel more confident in this journey. We do teach this material in our program, and in fact, we spend a whole day on it, but we also know that students still have questions after they graduate. So that's really why we wrote the book. And it's designed for new graduates or those about to graduate or faculty who are helping teach nurse practitioner students. So specifically, these are the topics that we're going to cover today. We'll provide guidance for a successful transition to practice, provide an example of an ideal orientation for a new NP, discuss how to attain and maintain your own sense of well-being during this transition period and throughout your career. And then finally, we have some specific tips and checklists to share that we hope will smooth out the journey for you. Dr. Ewen.
Okay, so what I'm going to address specifically is that transition from being a student to the NP in practice and what that big picture looks like. We all know it can be a very overwhelming process, and you go from being closely supervised as a student to suddenly being the primary decision maker and having to do everything on your own. So the focus of these first few months is really on building that competence and confidence. We're getting your speed up and your efficiency, that will come later. The longer that you are in practice, the faster you seem to go and the more efficient you seem to be. Although I will tell you, after years of practice, there's days where I don't feel so confident either. Mm-hmm. So remember that no one expects you to be perfect right away. That's really important. It's about the progression and not the perfection when you first start. So what we're going to look at is what to expect in those first few months. How do you set up for a successful transition? So what we're talking about particularly right now is the credentialing. Credentialing can take up to weeks and even months. On average, it's well into the second month before you can start to see that you're credentialed with specific insurance companies. So don't be discouraged if you can't start seeing patients on your own immediately. That generally doesn't happen unless you do all of the onboarding before you actually come into the clinic and start your practice hours. Use shadowing time to observe the clinic flow, understand the documentation systems, and just see how your colleagues manage their patients. It's a good time to shadow with a specific provider. It's important to give yourself the grace period here. Progression won't be linear. Some days will feel great. You'll think you're on top of it. And other days will feel like you're back in school and back at square one. And just don't be so hard on yourself during that time frame. Negotiate how many days of observation and how many days of getting up to practice are needed. When starting as a new nurse practitioner in the role, it's critical to advocate for your own gradual ramp up in patient load and not walk into a clinic and be expected to have that full load right away. Having a clear agreement with your employer about how many patients that you'll start seeing early on, it prevents burnout, and that's important. Set yourself up for success. Depending on when you start and whether you're credentialed or not, or if you're starting before onboarding, this process will be slow. In weeks 1 and 2, your time is best spent shadowing, learning the flow of the clinic. That's really important. Which clinic person is there to help you in your practice? Which clinic person gets the patient set up? How does that flow go? And starting out with a very light schedule, maybe just a couple of patients in the morning and a couple of patients in the afternoon. Remembering that also during this process, you have other onboarding tasks that might be required by your organization, modules from a learn perspective that you need to complete, paperwork that you need to complete. So make sure you ask your mentor or who's available to help you. What colleagues are out there that might be willing to help you and mentor you through this process so that you don't feel left without help at all when you need it. Ask for what your timeline for feedback on the credentialing and the process and your patient numbers. Are there going to be chart reviews? How does all of that work? And negotiate what you feel the most comfortable with. What I provided for you here is just an example that's reasonable for a progression over the first couple of months. You'll notice that you start with shadowing and observing during the first few weeks. That's key. The foundation is key. You've got to know how to progress. This may be a week or it might be 2. This is often a time where you don't have the ability to see patients on your own because of credentialing. You're going to see those patients with another provider so that the patient's visit can be billed. And there's from weeks 3 and 4, you're going to begin seeing patients a little bit more independently, but still have some close support. You may go in where you're seeing the patient first, and the provider that's mentoring you is going to come in and see the patient as well and bill for that visit. By week 7 and 8, you should be more consistent with your schedule. But remember, every practice is different. Some NPs may take longer to build to a full panel. Also have an idea of what the expectation of a full panel is. Set those guidelines early on. The bottom line is quality and safety are always important and come before speed. Employers should recognize this and allow that time for a safe and supported transition. What I want to talk about next is just a real life example. One of my former students came to me with the question of a job offer that she was looking at and what the process would be. And they had an outline of her progression, and she wanted to make sure she was doing this in a wise manner. So I brought that example to you here. The clinic that she was going to be participating in was a rural health clinic with clinic sites in 2 different locations. It followed under the rural health guidelines as well. So what their recommendation for her was to start with a stepwise approach and start the training as a mentoring in the clinic, in just one of the clinics. And by doing this, she was going to shadow specifically with the physician provider that was in the office, seeing patients with this peer, and they would bill for her services. They would be doing this together while the credentialing process was started by the practice manager. In step 2, the nurse practitioner would see the patients on her own, but have a peer and a colleague that would come in after and still complete that visit and bill for the services. Remember, during these types of visits where you are not the billing provider, that they have to come in and provide the same clinical evaluation in order to bill. They do all the decision making for that particular patient. In step 3, the APRN that was coming into the practice was going to go to the second clinic and repeat this process. Now, for her in the first clinic, it might have been over a couple of weeks. In the second clinic, she was going to do this over a couple of days, just to know how the difference in the flow of both clinics went. There was a different type of staffing, there was different equipment, all of that sort of plays into this role in making sure that you're comfortable in both clinics. As the credentialing allowed, the nurse practitioner then would start slowly building her own practice and her own schedule of patients. She would see them and bill under her own name and NPI numbers. So all of this is important to just illustrate how that process goes and why you want a slow process. In her case, she did take the job, and her orientation went over 2 months, primarily because it took 2 months for her to get credentialed into that clinic. Now I'm going to turn it over to Dr. Ossege to talk more about wellness.
So we wanted to spend a few minutes talking about wellness because let's say you're starting your journey, as many of you indicated that you are, after graduation for your first job, or you're starting your first job. All of these things naturally come with excitement, but also anxiety. And how are you going to maintain your sense of well-being as a practicing NP? That's really the question. As providers, we need to maintain a sense of calm, a sense of professionalism, so that we can use our brains to their optimum potential in patient care. A frantic brain, a struggling body can't always perform at its best. You've done the work, you've gotten the degrees, and it's perfectly reasonable now to attend to self-care so that all that you have learned can work for you and help you be the best nurse practitioner you can be. To that end, we included a chapter in the book on wellness. So some of our wellness advice naturally flows from what we've already discussed. Negotiating for a reasonable new workload, like Dr. Ewen just discussed. The other issue is having a cadre of peer confidants who are navigating the same process as you. It's important to have a group, maybe your classmates, other nurse practitioners who might be working in the organization where you're going to get a job, to debrief with them. Most importantly, so that you know you're not alone. You share stories, everybody's going through the same thing, and then you know you're not alone and it doesn't seem so frustrating or so daunting. And then most importantly, we've mentioned this before, but I'm going to say it again, giving yourself grace to trust the process of transition. It does take time. Things are going to ebb and flow. You're going to have great days and hard days. The ebb and flow is guaranteed. Just know that it's going to happen. But giving yourself grace is one way to manage those ups and downs. I don't know how many of you have already been thinking about wellness or engaged regularly in wellness activities. So I've listed some of the basics here, and I'm going to just go through them briefly. Mindfulness is a technique to intentionally manage mind and body systems so that you can manage stress. So the foundation of mindfulness is grounding yourself. And I don't know if everyone knows what that means, but it means to stay present and centered to help your mind and body remain calm and focused during stressful situations. So grounding techniques prevent your body from and your mind from becoming overwhelmed with emotions and worries, and it prompts clarity, emotional balance, and effective decision making. So examples are deep breathing, progressive relaxation, where you relax parts of your body in sequence down from your head to your toes. Box breathing, I don't know if y'all know about that, but it's you take so many breaths in, hold it for so many breaths, and then so many breaths out. It could be 4-4-4, 6-6-6. It's different for everybody, whatever works for you. But research shows that deep breathing truly promotes relaxation by slowing your heart rate, increasing mental clarity, and helping you feel calm. So it might be a good thing to do when you are outside of a room and you see what the patient's there for, you find out what you got to go do with this patient, and you need to take a couple, do some box breathing to calm everything down so your brain is at its peak. Exercise is another foundation of mindfulness and well-being. Moving regularly to maintain both physical and mental health. I think we all know that that is essential. Good sleep needs to be restorative. So think about sleep hygiene, being in a dark room, no screens for an hour before bed, those sorts of things. Having the room be the temperature that you need it to be. The screen thing is hard, but it is proven that that does help get a better restorative sleep when there's no screens an hour before bed. Nutrition, I think, is self-explanatory. You put good things in your body and the body works better. Hobbies also might be self-explanatory, but the purpose is really to engage in joy and creativity outside of work. One of the activities we suggest in the book is called Reflection for Growth. And so what this means is really to connect the activities that you're doing, the well-being activities that you're doing over time with your sense of well-being over time. So let's say you're going to start a new activity, box breathing, we'll say, and you start to journal about it. How did it work on day one? And every day or every few days you write about it. Over time, 1 month, 3 months, 6 months, whatever, you can look back at those notations that you've made in a journal and see how things have changed. So how has your stress level changed? How has this boxed breathing changed your mood or your thoughts or your sleep patterns? Reflection is where it transforms that wellness behavior then into a habit. So you start something, you write about it, keep writing about it, and then look back at those notes over time, and you can see for yourself how things might have changed. If you're not already into wellness, then maybe just start with one of these things above here. There's 5 things listed. Just try one. Maybe you take a yoga class once a week, or you get back into some hobby that you used to do before you started school and dropped off all of your hobbies. We know that happens. The main point is to think about you and your sense of well-being as part of what you're going to bring to your nurse practitioner career and what you're ultimately going to bring to your patient care.
Before I start talking about the checklist, I do want to make one comment on what Dr. Ossege spoke about earlier, the cadre of peers or cadre of support for you. That's something that's really important. And frequently having someone outside of your practice site that you can text to ask a question that you feel you should already have at the tip of your tongue is really helpful. We do this with our peers often. I have several people that I use, and I just will text a quick question if I'm drawing a blank on something, on a preferred guideline or a preferred treatment plan. So it's really helpful. I just wanted to reinforce that whole process that she talked about.
And I'll just say, we have 30 years, each of us over 30 years of practice, but we do this with each other. I just texted Julianne yesterday for something.
Yeah, it's really helpful just because someday your brain doesn't fully function and you're just drawing a blank on something you feel like you should know and you can't put your finger on it. The next thing I want to talk about is just some of the checklists that are in our book. This is a list of those checklists that are available to the book. And they're all helpful, and they all give you links to additional information. The first one that we put in there was just the licensing boards. Sometimes it's so hard to figure out where is it that you go to find a specific requirement or what you need for your state in your the licensing link. So we have provide a complete list, including the territories of the United States, for the boards of nursing licensing. And that, along with that, we've included what the recommendations are for your CEU, continued education requirements to maintain your license. Now, this will change over time, but this was accurate at the time of printing of this book. The next one is just a tool in which to keep track of your continuing education. Giving you an example here, we all know that each organization has its own tracking tool, and your boards of nursing may have their own tracking tool, and none of them talk to each other. So what I recommend to my students was that they form a file on their desktop, and every time they go to a program, they put it onto their tracking list, and they upload a copy of the certificate. So it's all right there when you have to go and put these on your association links, or when you have to upload them for your own board of nursing. It's just a quick and easy tool to stay sort of organized and not lose the documentation. We've all been there on the day that the licensing renewals are ready to go, and we can't find the one document that we need to upload to the board of nursing or to our credentialing body in order to stay accurate. The last one that we've put in there is just a list of professional associations. It's so important to remain active in our professional organizations, and we've got a chapter that discusses that professional home and understanding that these organizations also help us with regulations and law changes, and it's helpful to know how to find out the information that's going on with your specific legislators. What are they actually looking for? What law changes are in place? It's a quick link to these professional. It's not a complete list by any means, but we tried to put the top ones in there for you to have quick access to. Now we're going to open it up for questions. What questions do you have for us? What can we give you further information on?
Hello, I'm back and I'm going to field some questions and throw them your way if you give me a second. And we encourage everyone, again, you could either enter questions into the Q&A or into the chat box, and we will get them to Drs. Ewen and Ossege. So the first question, what are the most common mistakes new NPs make and how can they avoid them?
Oh, that's a good one.
Yeah, I would say that just the most common is not realizing that you have the basic information and not being confident in your decision making. I really think that that's there. There are days where things just don't make sense, and you have lots of information to access online through your textbooks, through your mentors, and utilize them. And I think that's something we don't do enough of.
I agree with that. Not using resources, and getting in your head about what you really know. But the other thing the thing in the process, I think that a lot of people could do better is the negotiating process, especially about that orientation, because it's so crucial to build your confidence during those first few weeks, and you want to make sure you've got the time and somebody in the organization is being patient enough to allow you to build your confidence.
Excellent. Next question. What advice would you give to the students who are on this webinar?
Be
Read the book.
patient with the process.
Yes, the process.
I mean, healthcare does not move rapidly as far as processes go. And the Board of Licensures, as much as we rely on them, move even slower. So don't feel like you're missing something when the process is going relatively slow.
Okay.
But you also use that time while you're waiting to get credentialed with an insurance company to shadow and do other continuing education that's required at a job, make sure your CPR is up to date and all of those things.
Oh, and I see a comment. Absolutely. Licensing takes a really long time. So there's an agreement there with what you're saying. Next question. How do you recommend setting realistic career goals during the first year of practice?
That's a good one. I think that it's important to talk to who you're going to be working with, whatever colleagues you're going to be working with. Could be an office manager also, but whoever the other providers are, to set goals about volume, but what you're doing on how good you're feeling on your own. How many patients do you need to be seeing in a month, in 6 months, in a year? How many, it's not unheard of to change a scheduling template also. So you might start with a scheduling template that lets you see a patient every hour and then every half an hour, and then building up to whatever is required at your place. And they can be different for different things. So a new patient could be 30 or 40 minutes. A follow-up or a sick visit could be 15. A follow-up could be 20 for multiple chronic comorbidities and medications and things you need to check. So I think just playing around with those the first few months and setting some goals about when you want to get a template set. The template you start with on day one does not have to be the scheduling template you use at 6 months or 1 year.
I agree with that, particularly the time frames. A lot of providers or provider groups have gone to a 20-minute time frame. That seems to be a standard in healthcare. Don't expect you to be comfortable with that the first 6 months. I mean, it's hard to just get the whole workings of everything and figuring out how you get your charting done and all of that together. So I do think setting it at one every 30 minutes and doing that for a while. Again, most of the time you're not credentialed with all the insurances, so it's an easy process of spacing those patients out. And then as you feel more comfortable, you can talk with your practice manager about increasing the number of patients. I think that would be really important.
Okay, so another question. What's the most important piece of advice you would give to a new NP transitioning into practice?
Allow yourself that grace period. Don't feel like you have to know everything day one, because you'll get really frustrated and then burn out a lot faster.
Great advice.
And keep in mind, I would also say, keep in mind there are 300,000-400,000 of us out there doing this, so it does work. It is possible to do. It's just step by step, and know that you're making progress. It just takes a while.
That's very reassuring. And I love how you framed it that way, that there's, what did you say, 400, 600,000?
300 or 400,000.
3 or 400,000. Yeah, you're in good company.
Yeah.
Oh, I see the Q&A box has lit up. Okay, so we have, my journey for job seeking is closed to 1 year. MDs stated that NPs are luxury medical assistant. Meanwhile, every NPs are entrepreneur, but do not hire new graduate NPs. How to really secure the first NP job?
That's a tough one. Well, I don't like that statement about us being glorified assistants, but is that what they said? Could you read that again?
I think the way they said it, MD, so I guess
I know.
doctors stated that
Yeah.
NPs are luxury medical assistants. So kind of the perception of what doctors may see NPs as
Yeah.
is what
Yeah.
this, yeah.
Yeah, I get it. I just hate that thought is still around.
Yeah.
After all these years. So now I forget the question because I was focused on
Oh,
that.
sure. I'm happy to reiterate it. So essentially, it's how to really secure the first NP job with all of these obstacles that are out there.
Right, because they want you to have experience. Ooh. I don't know if I have any good advice about that.
You know, I think one thing is to keep in mind that they're going to find that their need and the number of nurse practitioners looking for positions, there are a lot of us out there that are looking for positions, and not many, once they're in a secured practice, that are looking for new. So as an experienced practitioner, I don't go out looking for the positions anymore. And I think they're going to find they need to start utilizing the new nurse practitioners. Our organization, the one I have my clinic with, that was their rule initially, was that you had to have at least a year's worth of practice in order to come in and participate in their organization. And they quickly found out that they couldn't find anybody. There was no one looking for the positions. So in my area is a relatively urban area. I live in Lexington, Kentucky. So there's a lot. There's 4 schools of nurse practitioner with nurse practitioner programs in my area. So they finally realized that they needed to tap that resource of new nurse practitioners. And what they did was to set up a mentoring program. And you can go in with that in mind and say, I will give you a longer than normal probationary period if you would consider me for the position. This is an organization. Do your research. Find out if it's really an organization that you want to work for or a practice that you want to work for, and then offer an incentive to try it, right? I'll go in and say, I will work for this, and in 3 months we can renegotiate. But know those kind of things ahead of time. That will help. There's also some organizations, and I'm not a big fan of these, but there are organizations out there now that are offering, in essence, fellowships to practice. Again, I'm not a big fan of that. You've had enough clinical practice. You are ready to go out and be a working NP. But if the restriction is you have to have experience, then you might look at some of those programs that might be in your area.
And from the chat, a helpful tip came in saying if you use a job search engine online, put in new grad as a criteria. So that's good to help filter the jobs down to those who are willing to look at new grads.
Yes. One other suggestion I have is, and this recently, a certificate graduate of mine, one of my students did this. They volunteered at a clinic, like a free clinic in town. And this person was already a acute care nurse practitioner and was switching to family, but didn't have any family experience. So they volunteered in this clinic and essentially did family nurse practitioner work, and gained some experience with outpatient management of diabetes and hypertension and multiple comorbidities on an outpatient setting, things that they had not done as an acute care, and then found a job in a family position that they were very comfortable in because they had had 5 months of volunteering in a primary care, sort of a primary care setting. So that's an option.
I think all of that is very good advice, and it could be a challenge in this current market to find positions. So great advice for helping those new NPs look for positions. And I know you have more in the book, so that's great. I'm looking to see if there's any more questions. I'm going to ask you one that I think might be a fun one, which is for each of you, what is your favorite wellness strategy? Because there's so many things, right? Exercise, eating well, the sleep, what or the hobbies. What do you like to do for your wellness strategy?
Well, mine's knitting. That's my stress reliever. I use it for a lot of purposes, but I can go pick up a project and work on knitting. And I have 2 grandchildren now, so all of them are generally dedicated to them. But it just gives me a way to work through that frustration. And my husband will tell you that the faster I knit, the more frustrated I am about whatever the issue is I'm trying to work through. But that is my mind break.
That's excellent. And you got a thumbs up when you said that. Like someone gave the
Good.
thumbs up on that. So you've got a fellow knitter out there.
Good.
So I have two, I think. I love to sleep and I have got to have my sleep, so I'm very attuned to getting enough sleep. But my other issue is hiking. I It clears my mind. I don't like to really hike with other people because I don't want to talk. I just like to listen to the birds and think and a dog is always good to take a dog, but I love being in the woods and hiking.
Oh, those all sound like excellent strategies. So, oh, and we have someone sharing, I've gone back to reading for enjoyment in the chat. So
Yay,
everyone's got
yay.
their coping, and that's great. Well, I heard a podcast the other day, and they said the acronym SPACE, which I thought was very helpful. It was sleep and like let's see, the A was activity, the C was creativity, the E was eating, and I want to say the P may have been something along the lines of the mindfulness, being present. So
Yeah, yeah,
it was a fun acronym to remember these important elements.
yeah. And we get in weird modes during times when we're in school. We're ignoring hobbies, ignoring sometimes eating good food and having a decent sleep schedule. So once you're out of school, all of that can change and you can make it look different.
Great
It's real
advice. I think that,
exciting.
oh, go ahead, Julie, please.
It's real exciting to read a book that's not a
Yeah,
textbook that
right,
first month out of school.
right.
That's right. And I was going to say, I think this is a great note to end our Q&A session on. So thank you everyone for that submitted questions. And we could move on to the next slide. And well, I'd like to say is thank you to everyone for spending time with us today. And thank you again to Doctors Ossege and Ewen for a great presentation. And you could see email contact information for both of them there. So if you have a question or you just want to follow up or ask about the book or their rationale for doing it, their practice, they are open to additional questions. And if you're interested in purchasing Guide for the New Nurse Practitioner, Transitioning into Practice, or any of our other products in celebration of NP Week, we have a coupon code NP Week, which you see it there on the screen, and that's for 25% off through November 16th, which is this coming Sunday. So definitely act on that if you're looking for any product that might be helpful for you in your career. And while this was the final live webinar of NP Week, we will be offering recordings of all 5 webinars we hosted this week. And any attendees of today's session, you're in luck. You're going to get a free gift from us, which is actually a chapter from Dr. Ewen and Ossage's book, Guide for the New Nurse Practitioner Transitioning into Practice. And the chapter is all about finding your professional home. So that dovetails nicely with the question we were asked about finding a new position. And you'll receive that in an email following the webinar. Oh, and I saw one more note come in while I was doing my little spiel at the end, which is prayer as wellness, which is definitely
Yes.
important for those who adhere to prayer or meditation, however else you ground yourself. So it's a good piece of advice. And
Good
you
one.
see the email there for marketing at Springer if you have additional questions. But again, thank you. Happy NP Week to all. We appreciate your joining us today. And I hope everyone has a wonderful weekend. Thank you, Julie and Julianne.
Thank you.
You.